So we're going to do a pregnancy test, an HCG test, using the Clinitech. What's kind of nice is that you just have to flip the device over and put it back in. And so then, instead of asking for a strip test, you're going to ask for a cassette test. And so now it's going to ask you for who you are, because you need to take responsibility for the testing. You're going to get that a lot. Your employee number is going to be following you for every single test that you do during a day. So then you're going to have your cassette. Go ahead. And so then it's telling us how we're supposed to adjust it. Did you already tell us who it was? Okay. So if you take a look at this cassette, what's kind of nice is that many of these you read manually, but this analyzer will actually do it for you. So you're going to go ahead and put that cassette into there, and then you are going to put
A dropper full of this right
So
into this.
it needs 200 microliters for a single test. So when we're using a sample, we have this nice handy dandy pipette, but typically for QC it's about 3 drops. So this is level 1. Hit start. So the nice thing is that the analyzer is going to be doing all the timing. And if you take a look here, you could just see the urine going through the paper. You really need to take a look at how this test is actually working as an MLT. You need to know that. And now it's pulled itself in, and now the countdown is for 4 minutes and 40 seconds. So the nice part is that the instrument's doing the work for you, but you're going to have to wait about 5 minutes for every test. So in the student lab, you may have other brands that you're going to do manually. And so let's go ahead and, so this is the Clinitest HCG. It's going to be very important that you take a look at the manufacturer's insert, understanding the chemical reactions that's going on and how that whole system is working. So while we're doing this one, we have 3 minutes here, we're going to go ahead and explore a Henry Schein one-step. So what you're going to do, again, it's easy to do, but you need to take a look at everything about this. How are these stored? What kind of sample do you need? How is the sample stored? And what quality control do you need? What we would expect our results to be, and then anything with accuracy and sensitivity and specificity. So that's beyond this video. I just want to have you take a look at, you should be following manufacturer's insert and your standard operating procedure, which is really based on a manufacturer's insert. So go ahead, and we're going to do a positive control and a negative control. So just open them up. So here we could be doing a bunch of tests all at the same time while the analyzer is doing one test. So sometimes automation is nice. So do one more, because then we're going to have level 1, level 2, and then the patient's name on it. And I actually, because it's QC, I really like to make it very clear what it is that you're doing. Because sometimes you might set something up, but there might be another person coming behind you when the beeper comes out and reading it. So it's very important to be very clear about what it is that you're going to be doing. So the directions for use then is to remove the test cassette and then place it on a level surface. And then you have this pipette and transfer 3 full drops of urine or serum, this one has either or, and make sure that you don't trap any bubbles. So we don't have to use a pipette for the controls. So go ahead and put 3 drops. Yep, and it actually says on the cassette, drops times 3.
I don't have a timer.
Level 2, we'll watch the time for you. And so with your patient, you will need to use a pipette that the manufacturer has provided. And again, this is a qualitative method. So we set the time for 3 minutes. And you can see how she's labeled it, and then that's where the urine went in, and it's diffusing across. And then there's going to be the test is going to be at this area, and the control is going to be at this area. And you can already see this red line here indicating that the control is working. So it's an internal control, but we're also doing quality control to make sure that this lot number is working as it should. And so then we have QC2. We're still a minute away from reading it, but you can see that the control line is there, and there's already a line in the test. So the analyzer over there, we've done 1 in the time that we've set up 3. So again, it depends on your lab's workflow, if it makes sense to set a number of things up at the same time, or is it more handy to have the analyzer to read it. And there's a cost difference. So an MLS typically is more involved with the selection of the analyzers, the validation of the analyzers, making sure the analyzer is working as they should. So another 47 seconds. So right now you can see that the positive control is clearly positive. But we would want to wait for the time that the test says before we would make the final confirmation of the test results. And then we would have a worksheet here so that we could record what the results are. Again, the nice thing about the analyzer, it also then can talk to a computer and give the results over, whereas everything here we would have to manually enter into a computer system to report it. So this is now 3 minutes. So this only control line, nothing at the test, that's a negative. And then this is the control, and you can clearly see 2 clear lines where they're supposed to be, so that's positive. And our patient, just the line in the control, nothing in the test area, and so the patient, their HCG is negative. So this was the Henry Schein, and then we're going ahead and setting up the analyzer for the Clinitect. So 3 drops. It's already started getting the timing set, and the analyzer is thinking and calibrating, and it's going to bring the cassette into its own system, and then it will count down about 4.5 minutes. But it's always good to see to make sure that your fluid is going up the strip as you expect. So again, being very careful about patient identification, sample identification, and then how you're going to record the results. So in a student lab, what I like you to do is to be sure you could do an automated with the analyzer, and that you're at least doing one other test. And then most importantly is taking a look at the details, because who else is going to know all of the details if it's not us? Because you might have nurses and other people that are non-lab people doing this. So again, making sure we know what samples can be done, because this particular one can be both urine or plasma. So, but this is it's only giving us a yes or no, is it positive or negative? It's not giving us a number. There are other assays to be able to determine the amount of HCG.